Hi, my name is Nurse Choma. I am the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. I am a registered nurse. I graduated from San Diego State University with my Bachelor's of Science in Nursing degree in May 2010. So I've been a nurse now for over 8 years. I practice med surgical and tele-nursing for over 4 years, and then I practiced about insurance nursing for about a year. And then now I've been helping people to pass their exam for 3 years, and it will be 3 years. It's been 3 years exactly this month. I started doing this literally 3 years, June 2015. So I am excited to be here today. We've had many testimonials, at this point now, hundreds of testimonials of people who have passed their exam after receiving my help. What makes us different is that we like to focus on individuals who are struggling to pass their exam, those that have taken the exam, 3 times, 4 times, at whatever number of times it's been. We're here to definitely help you. I've had a great success rate with people who've taken their exam okay, all right, sorry about that. The signal is stopping. All right, so anyways, let me keep going. So we've had a great success. You can go to our website, choosingnursing.net, to learn some of our testimonials on there by going to the testimonial section as well. And then if you're having any problems hearing me, just say right now, if it's clear, put 1 for clear, 2 for not clear, really quickly in the chat box so I know that you're hearing me and seeing me okay. Hopefully it won't stop again. I don't know if it will or not. I don't know why. So but anyways, though, wanted to share with you too as well, if this is your first time watching me, thank you for watching. My name is Nurse Choma. I would encourage you to go ahead and like the page right now, so that way you get a notification. Okay, great. That way you get a notification whenever I come up live. So and that way you don't miss any of these teachings, because I promise you I give you great information. Also, you can also follow me over on Instagram. I'm over on Instagram, choosing_ over there. All right, choosing_nursing, and you can follow me on there. And you can also follow me over on Pinterest, which is Choosing Nursing on Pinterest. And then finally, you can follow me on YouTube as well, also Choosing Nursing. So those are all the platforms as far as nursing wise that I'm on, where I give you that type of content that you need in order to really succeed in this field. Because I don't know about you, but you need encouragement, to be able to finish nursing. Nursing is not like any other career, right? So you need to see something that will keep you encouraged. So good to see you. Okay, great. I'm glad. The ones, thank you so much for telling me. So now I know it's clear. Awesome. So thank you for watching. Also as well, if this is your first time, if you never ever signed up for my mini course, I do have a free NCLEX prep mini course. That's what it's called, NCLEX prep mini course. Whether you're taking your RN exam or your LPN exam, if you want to sign up for that free course, simply type the word mini, MINI, right here in the comments, and then we will send you the link through your messenger box in order to sign up for the free course. So it's pretty much a series of video teachings that you'll receive over the course of 4 to 5 days, and I'll go over content with you. So if you're struggling with content, this is probably something that will help you. And then if you don't have Messenger or Messenger at all, then just go to bit.ly/free NCLEX prep course. All one word, all lowercase. bit.ly/free NCLEX prep course. All right, and then one more announcement as well. In addition to that, I am having not this month, but next month, Saturday, July 28th, all right, from 10 a.m. to 6 p.m. Eastern time, I'm going to be having an 8-hour NCLEX RN Review crash course class. One more time, it's going to be an 8-hour NCLEX RN Review crash course class. So what this pretty much entails is that I recognize that for some people, you don't have a lot of time to prepare for your exam. Maybe you're in a position where this is your last year to take your test, right? And you have to take your test now because of state requirements or whatever it is. So what I decided to do, I put together an 8-hour review, because there's some people too that you can't afford to pay for 3 days or longer. So for that reason, I wanted to make myself more available. So this type of class is ideal for people who are first-time test takers, people who are kind of like on a budget, but you just want to get everything you need to know in one day. So I am going to go over all the categories of the test. So I am going to go over within 8 hours everything, and also go over strategies. So I'll give you really a good foundation to help you, to really get you prepared. It's going to be a lot to cover in 8 hours, but I'm committed to do it, and I know I can. So thank you for the beautiful likes and hearts. I can see it right now on the screen. So if you would like to learn more about the 8-hour crash course, which is going to be next month, Saturday on July 28th, type the word crash in the chat box, crash in the chat box, and we'll send you the link that way through Messenger. Or if you don't have Messenger, just go to bit.ly/RN crash class, bit.ly/ all lowercase, all one word, RN crash class. Okay, so and this is the thing about it too, I would not encourage you to wait till the last minute to sign up for that class, because there is homework attached to that class too. So one of the bonuses is that you do get a bonus, which is our body system crash course, for signing up for that. So with that, there's homework involved, and the homework is for you to consume as much possible of that course before it starts on the 28th, so that way you can really get a strong foundation before the 28th begins. Okay, sorry about that again. Okay, so I'm gonna go over, so today, if you're on the email list, I did send out an email this morning called Understanding Pediatric Disorders. All right, okay, I'm sorry, I was like cut off when I said it. The class is ideal for those who, if you need a lot of it's going to be a full content review, and it's going to be strategies within 8 hours. So it's ideal. It's if you're a repeat test taker, it will also help you too, because I'm going to go over the content. I will still recommend, because you will get the recording for the class. So you're going to get the recording, you're going to get the crash course and everything. It's also ideal for repeat test takers. If you're a repeat test taker and you don't have a lot of time to study for your exam, then this will be ideal for you. If that's not you, then you may need to you may benefit from more like one-on-one help, or our 3-day review class, which is in August, but that's not until August 23rd to the 25th. All right, but yeah, it is ideal for repeat test takers as well. Okay, so today I sent out an email this morning called Understanding Pediatric Disorders. So hopefully some of you got that email. If you did, let me know if you did. And I talked about pediatric disorders, because I know one of the areas that a lot of people are not confident in is peds. I don't know about you, but I'm not. When I first started into it, I wasn't super confident about peds, because it's like babies, and you're giving them meds. So it's more, you have to be more careful, because you can easily, hurt the child. So you have to be more careful. So today I want to go over with you 5. Hey Nicole, good to see you. Good to see everybody that joined. I just realized I didn't say hello. So Naz, let's see, Maria, Hazel, Purity, Irma, Omatoya, good to see you, Renee, Sarita, Claudia. Thank you to everyone that joined. I'm glad to see you here. All right, okay, good. Okay, so yeah, I want to get right into it. So there are 5, there's 5 of these. Okay, if you have questions, give me until the end of the broadcast, and I'll answer your questions. Give me till the end of the broadcast. If you have questions that are outside of what we're talking about today, give me until the end of the broadcast, and I'll answer your questions if we have some time. Okay, so I'm going to go over 5 pediatric disorders with you, okay? So I want you to get comfortable with peds. All right, I do want you to be, because it is a portion of the exam. What I've seen for some people is that they take the test, and when they took the exam, they got a lot of peds questions. They got like a whole bunch of pediatric questions. So and so they weren't, and then they didn't pass the exam. So they're thinking, okay, that's my weakness. So I want you to be comfortable with peds, right? Because you can see that on the test. So I'm going to go over with you 5 today to help you feel a little bit more comfortable when it comes to peds. Check out the email. If you did not get the email, check it out, because I did mention some things to lay a foundation with what I'm talking about right now. So check that email if you did not get it. If you're not on the email list, join the email list. Just go to the website. You can go right above this video and just click on the 10 mistakes guide, and you'll be on the email list that way. Unfortunately though, you already missed the email I sent out today, but you'll be on the email list for future videos or future emails. Okay, so number 1, the first one, if you're ready, put ready in the chat box. Thank you for the likes, for the hearts. I apologize for the stopping. It may do this, it may unfortunately do it, I don't know, again, but I'm hopefully not. All right, I'm gonna try and go right into it. If you're ready, put ready in the chat box. Okay, I'm gonna give you five disorders, ones that you definitely gotta know. What this will do is it will lay that foundation for more. So that way, okay, now I understand what I should focus on, you know, when it comes to peds. So I understand, so that way you'll understand more pediatric disorders, you know. And one thing I'll tell you too, it's not hard. It's not hard. The reason why it seems hard is because you're trying to learn all the information at once, but you're not creating first a foundational ideology to grasp the foundation. Meaning that it's like me trying to teach you algebra, right? But then you haven't really learned addition. So I'm trying to, the algebra is going to be confusing because I haven't created that foundation with you with addition. Same thing when it comes to this information. So the first one, number 1, is pyloric stenosis. Pyloric stenosis. So here's the thing. Okay, the better you understand how the body normally works, the easier this will be. So this is what happens with our body. So you have the digestive system, right? So what happens is that we eat something, it goes down through what? Our esophagus, and then it hits the stomach, right? Once it hits the stomach, then from the stomach, it goes to the small intestine. That's how food travels through our body. So here's the thing though, there's something called a pylorus, all right? It's like a valve. It's a muscular valve. And this valve is located between the stomach and the small intestine, okay? Hopefully you're catching so far. So this valve that's where it's located. But the problem though is that a baby, usually it's babies where this occurs in, it's because it's normally, it normally occurs like congenitally or within about 3 to 5 weeks of birth. So usually what will happen is that this valve, that's the pylorus, for whatever reason, it's like thicker than normal. It's like really thick, it's stenotic, meaning that it's closed up. So instead of it opening, right, to allow food to pass from the stomach to the small intestine, it's instead thickened and stenotic. So the food is not passing normally. So that's why they have pyloric stenosis. All right, so pretty much it's just that this valve is just like it's like thickened, it's like it's stenotic, and it's not passing like the way it should with a baby that has pyloric stenosis. So here's what happens. Okay, for that reason, the symptoms that the baby has it's very, very unique. The number 1 hallmark symptom of pyloric stenosis is going to be projectile vomiting. Projectile vomiting. So meaning that, just kind of think about it. Imagine that my fist is a stomach. Just imagine that right now. My fist is the stomach, and then my finger right here is the valve. Okay, just remember that. Just imagine that right now. So my fist is the stomach, and then this is my this is the pyloric sphincter. All right, that's what it's called, the pyloric sphincter. So with somebody who has a normal pyloric sphincter, right, it will just open and allow the food to pass, right? So it will just open. Just pretend like this is opening. But unfortunately though, with somebody where the valve is stenosed, it's like the food is trying to go, but it's not. It's stopped, right? So for that reason, when food when food goes down the stomach, what does it do? It just vomits it up really, really fast. It like ejects it really fast. And because of that, they have projectile vomiting. That's the number one hallmark sign with them. Also as well, they may have like diarrhea, that kind of stuff. But usually for the most time, that's the number one thing. Also, they're going to experience, because of that reason, they're going to be very hungry all the time. They're going to have persistent hunger. They're not going to be able to gain weight. You know, those are some hallmark signs of somebody with pyloric stenosis, right? They're not absorbing the food like they're supposed to. It keeps throwing up. So the way that we treat this, remember I said 3 to 5 weeks. So it's early in birth, right? Usually it shows up early in birth, as soon as they're born. Okay? So the way that we normally treat this is by doing what you call a pylorotomy. And let me spell it for you. P-Y, hopefully I'm saying this right, P-Y-L-O-R-O-T-O-M-Y. All right, P-Y-L-O-R-O-T-M-Y. So pretty much that's what it is. What they're going to do, they just go in, the doctor goes in, and they cut, all right, and they create an opening, so that way it passes through. All right. I misspelled it. P-Y-L-O-R-O-M-Y-O-T-O-M-Y. I know it's very long. P-Y-L-O-R-O-M-Y-O-T-O-M-Y. Okay? So that's how you spell, that's the procedure they do. They just go in and cut. All right? That's why they have pyloric stenosis. So you see what I did right now? See how I explained to you how the stomach happens and the sphincter, all that kind of stuff. That's the patho, right? That was the patho. The reason why some of you cannot remember, or you're confusing, or you're not able to retain the information as far as the content, is because you're not confident with the patho, right? And so that's why you confuse some of the diseases between each other. So learning that doesn't let me ask you right now, learning that information, doesn't that help you to remember it faster? Like now you're not, oh yeah, okay, like okay, so that's what's going on between the stomach and the small intestine, right? So I don't know, I wouldn't say if it's an olive shape. I mean, I guess you could say it's an olive. I don't know. I'm not sure if I would classify as an olive shape. But it's pretty much like there's like like that valve though. It's not. It's like it's thickened though. So I don't know if I guess maybe you could say it's an olive shape. I guess I don't think about the shape. I just think about what it does. But yeah. So you see how the difference that makes. So that's why you have to get comfortable with the patho. Otherwise, you're gonna mix up the symptoms. And you'll mix up the treatment, right? Okay, so that's the first one. That's number one. Second one, Hirschsprung's disease. Hirschsprung's disease. Let me spell it for you. Hirschsprung. It helps a lot? Okay, great, Maria. Hirschsprungis. Disease. All right, so this is a condition. Now this one's also congenital too. All right, so this is where instead a portion of the large intestine, which is like the colon, is for whatever reason it's like ischemic, or it's not it's ischemic, or it's like diseased. There's not really a specific cause as far as like why this happens. Sometimes it can be inherited, but the nerves though, for whatever reason, they're not able to, so this is what happens in our body or in our digestive system. It does something called peristalsis. Peristalsis is the movement, right? The movement of the stool and everything to pass throughout the body. But for whatever reason though, there's an issue with the colon though, where it's not producing normal cells to be able to do that activity. So as a result, a portion of that of the colon, it's like diseased, so they're not able to pass stool like the way they're supposed to. Okay, it doesn't pass very well. So as a result, because the stool doesn't pass very well, similar symptoms in the sense that they're not gaining weight. Their stomach is going to be more swollen, right? See how you see the symptoms are different now? Their stomach is more swollen. They will also throw up, but their throw up will look more like green though. It'll be like a green, brownish color, that they vomit everything. But they're not really passing. If they do pass anything out of their rectum, it's going to be more like, very liquid. It's not going to be a whole lot coming through. So you're gonna see them. They're gonna vomit like a green brown substance. Their stomach will be big, and then also they're gonna not be able to gain weight very well. Okay, so with this one, the way that we treat this one, once again, like I said, it's congenital. The way that we treat this one is that we're going to pretty much do surgery again. Okay, we're going to do surgery again. So, but here though, now we know though the surgery is in where? The colon, right? In the large intestine. So this is when we may do a colectomy, right? And depending on the degree of how much is diseased of the colon, how much of it is not is ischemic, or I should say ischemic or diseased. That's how much they're going to remove and do what you call anastomosis, which means that they're going to reconnect it together. In some situations though, they may need to have a colostomy. All right, so this is so in some situations though, they may have to do a complete ostomy, and now they have a colostomy. Like I said, Hirschsprung's disease is usually congenital. It's not something that usually we see in adults. Something that's usually that occurs at a young age. Okay, when they're babies. All right, so that's what Hirschsprung's disease. The issue is occurring in the colon now. All right, in the large intestine now, right? And so as a result, let me give you the specific type of language that I like in here. The nerves in the nerves in the muscle, or the nerves in the colon, control the muscle contractions, right? That move the food throughout the bowels. But for whatever reason though, these nerve cells are not forming correctly in the colon with somebody who has Hirschsprung's disease. Okay, so that's why their stomach is so big. And that's why they're not, going to the bathroom like the way they're supposed to. And that's why we need to do a colostomy or ostomy surgery. All right, so see how that makes a difference? This is the diagnosis that they do way to do? Yeah, yeah, this is the one that they would do like a colostomy or ostomy procedure. So this is why, and I mean, ideally we don't want to do that. We want to do an ostomy, but because think about it, if we're gonna do whether it's a partial or full ostomy or full procedure, then that means they're gonna have a colostomy for the rest of their life, right? And they're babies, so it depends on how diseased or how bad the colon is affected. But for the exam though, you should know the patho, like I just said right now, and you should know the symptoms, and you should know the treatment, which is to do either a surgery to anastomose it together, or to do a colostomy. All right, that was number 3. That's the third one. Okay, I'm sorry, that was number 2. All right, the third one, number 3. Race, and a lot of these you'll notice, some of them they don't have, except for this next one. Some of them they don't have a specific cause. It's just like inherited, or it's in their family line, that kind of stuff. Number 3, Ray's syndrome. Ray's syndrome is so we know this usually occurs from what? Thank you for your good work and teaching. I passed. Oh wow! Oh, congratulations! Oh, thank you for sharing that. I'm so excited. You passed your RN exam. Look at that, you guys. Congratulations. Wow, this is it's so awesome to see people who list, who take advantage of stuff and pass. Thank you for letting us know. Everybody just say congratulations to her, to them. Let them know right now. I'm so excited that you have passed. Thank you for sharing that. Congratulations. That is such wonderful news. Now you can go on and enjoy your career. So just be encouraged that if a knot can do it, so can you. Right? So can you. So thank you for letting us know. I'm so happy for you. I'm very excited for you. All right. So the third one is Ray's syndrome. Ray's syndrome. So Ray's syndrome, this is a rare but serious condition that can occur from, like a viral infection or from, taking too much aspirin. This is why we don't like giving aspirin to children, or babies, because they're more prone to develop Ray's syndrome. Okay, so it can also occur from flu. It can also occur from like chicken pox. Those are all some examples where it can happen as well. All right, so with Ray's syndrome, here's some of the symptoms that makes this so. Now try and think about what I just said right now. So remember I just said right now that literally this is something that's caused by like aspirin overdose and all this kind of stuff. So what this does is if it can cause it can affect the liver. Okay, it will affect the liver. So you'll see these patients, their liver enzymes are elevated, right? So all their liver enzymes. Oh, my friend said this. If you find this helpful, share this video right now, you guys. Share this video right now. Let other people know that I'm on live. Share this in your NCLEX review groups or wherever you want to share it with. I would love it and appreciate it. Thank you so much for sharing already and for the likes and the hearts. All right, so anyways, like I was saying, is with Ray's syndrome, with this one, the symptoms we're going to see, they're going to also experience elevated liver enzymes. You're going to see elevated ammonia levels. All right, elevated ammonia levels. So we got to check their ammonia levels when they have Ray's syndrome. So that's going to be usually increased as well. All right, I don't know if anybody can actually, well, let me keep going. So depending on how bad it gets, right, if you don't respond early, they can also have confusion, seizures, all this kinds of stuff. Thank you for sharing. I appreciate you. Confusion, seizures, swelling around their brain. Those are all some things. Yeah, hepatomegaly, that can happen as well. So the liver is inflamed. That's the biggest thing that's happening with these patients who have Ray's syndrome. Now, one of the ways that we can diagnose it is from doing what's the word I'm looking for? A lumbar tap. We also diagnose it obviously from collecting history, collecting their labs, collecting their ammonia levels. That would tell us, this is Ray's syndrome as well. All these things will be some signs. Like I said, this is normally in children. So the biggest way that we treat Ray's syndrome is that we're going to give them fluids. So we're trying to wash it out. So fluids, also I think that's the main thing. Fluids, and then also medications. Why ammonia levels? So I'm trying to remember the specific pathophysiology behind ammonia, but I can't remember exactly. I think the ammonia, though, one of the things what I remember is that when patients have, let me tell you right now, when the liver is messed up, oftentimes the ammonia level is elevated. I remember seeing this also with patients who have alcohol abuse. Their ammonia levels also go up too. So the inflammation of the liver triggers elevated ammonia levels. So that's the strongest I can tell you with the patho, but just remember that it does increase the ammonia levels. So we're gonna give them fluids as well. Obviously, if we can treat the underlying problem, but we're gonna give them medications. We're gonna try to also decrease any type of, because sometimes it can happen because, like I was saying about the swelling in the brain. So we want to decrease their intracranial pressure, those kind of type of things. Some of the medications that we can give them, depending on the symptoms that they'll have. We can give them like vitamin K, because some of them they may experience like bleeding. Some of them they may need plasma. They may need platelets if it worsens. And then also diuretics, because if they're having this swelling in their brain, the diuretics will help to decrease that as well. There's one medication that I'm trying, that it's like off the tip of my tongue right now. It starts with the letter M, like it's literally at the tip of my tongue right now. I can't remember at the top of my head, but it's a very specific medication that we give that treats swelling in the brain. If you can think of it, let me know in the chat box. But I believe it starts with an M, either an M or an A. But there's a specific medication though that helps specifically with swelling in the brain though, that we're known to give in critical ICU settings. But the number one treatment, like I said, is to give them fluids. We also want to respond by precautions in the future, obviously. So, that's going to include not taking the aspirin in the future. If it's caused because they have the flu, then we're going to... Thank you, mannitol. I love you, Nicole. I knew it started with the M. That's it right there. You guys are on it. Good job. So yeah, those are some things that we're going to respond with as well. Lactulose, no. We don't give lactulose for Ray's syndrome. Lactulose is more so if they have, which one I'm thinking about? Alcohol abuse from like cirrhosis. All right. You know what lactulose does though? It does treat the ammonia level. Lactulose helps to reduce ammonia level. The byproduct of that though is that it will cause them to have to go to the bathroom a lot though. So they will have a lot of diarrhea with lactulose. So lactulose can lower the ammonia levels. From my notes, I don't have lactulose as one of the medication treatments. That's why I'm not saying that's the treatment, but it is known to treat ammonia and help to bring them. I've given lactulose just because the ammonia is elevated, but it's usually in patients who have a history of alcohol abuse, who have liver cirrhosis, not patients who have Ray's syndrome. I think lactulose may actually be, because remember this is children, right? So I think lactulose may not be appropriate to give to pediatrics. Okay, so these are great questions though, by the way. You guys are really on it. You guys are really thinking more critically. Okay, so so those are the things. I think one thing I forgot to mention about the symptoms is that you're going to see diarrhea. And the biggest one is going to be vomiting. Vomiting. Thank you, Sandy. Osmotrol. All right, so that you're going to see diarrhea. You're going to see persistent vomiting as well with these patients. They're going to be, if they become lethargic or sleepy, that's an indication that something's wrong, right? And that's usually a sign that their ICP levels are increasing too. So, but vomiting, diarrhea, these are all the hallmark symptoms of Ray's syndrome. Okay, all right. So those are the first three. Okay, those are the first three. Is this helping? Are you guys getting some of this information so far? Are you finding this kind of helpful? Hopefully you are. I hope that you are. I hope some of this stuff is making some sense. Even if this is your first time hearing it, what it will do though is that it will kind of trigger something in your mind. The way that our brain works is that we have something called short-term memory, right, and long-term memory. I don't know the specific amount of time it takes for us to take short-term memory to long-term memory, but when you hear something, right, and you keep hearing it, you're translating the information to long-term memory so you don't forget it. So some people, they struggle though with retention, right? They hear something but then they forget it. They hear something and they forget it. So they just have short-term memory. So by listening to the information though, at least what it's going to do is going to help translate it to long-term memory, depending on hopefully how you're hearing it, and you're writing some notes down. All right. And then also, like I said, if this is your first time watching, thank you for watching. Thank you for sharing. I'm glad that you're here. If you're not part of my free mini course, I have a free mini course called NCLEX Prep Mini Course. Type the word mini, M-I-N-I, in the chat box. We'll send you the link to sign up for that course. It's free. You'll go over content, learn new content teachings, once again of me explaining the information like the way I do right now. And then also as well, If you don't have Messenger, just go to bit.ly/free NCLEX prep course. How old is a good age to give aspirin for kids? 12. No. So we want to avoid children, like babies and adolescents. All right, babies and adolescents. Those are the ones that we want them to avoid taking it. Okay, so let me keep going. So there's another condition called this one's really long, so I'm gonna need somebody to type this in the chat box. Esophageal atresia with tracheoesophageal fistula. One more time. Esophageal atresia with tracheoesophageal fistula. All right, so let me spell this. Well, actually, I'm not gonna spell. I'm sorry. That was too. I'm sorry. We're gonna be on here for a long time. When is the course in the? Oh, the courses, you can sign up at any time. It's a free course. You just type in the word mini or go to bit.ly/free NCLEX prep course. All right, so esophageal atresia with tracheoesophageal fistula. So this is pretty much, oh, I love you, Deborah. There you go. Deborah put it for you right there. So this is pretty much where patients, they have two disorders at the same time. Okay, they have two problems at the same time. So pretty much what's happening here is that the esophagus is connected to the trachea, which is not normal, right? That's very bad. So so pretty much that's what's going on with this issue, right? So there's a connection that should not be there. And it's usually also congenital, okay? So meaning that they're usually born with it. So we'll know, this is stuff that we should know immediately once they give birth, right? Once they give birth, it should like, bam, okay, you know, they have, we should be able to see there's something wrong immediately, right? That's why it's important to do the APGAR scoring as soon as the baby gives birth. So anyways though, so it's pretty much two disorders of the digestive system where there's a defect and the trachea and the esophagus is connected, which is not normal. So in this, what happens with these patients, they're going to have what you call the 3 C's. All right, the 3 C's: coughing, choking, and cyanosis. Coughing, choking, and cyanosis. That's what you call the 3 C's. So they'll cough, choke, they'll be blue, all that stuff, and you can, all that stuff that's obviously bad, and so with these type of patients, we can also see they may have, they may be like drooling a lot, those are also some symptoms, but just definitely make sure you remember at least the 3 C's that I just showed with you right now. One of the ways that we identify that they have this is that we cannot. We try to put like let's say like a catheter or a tube down their esophagus to their stomach, and it's not going through. Maybe like a nasal cannula or something, but we're trying to put something through their mouth, but it's not passing. That's one way that we diagnose it. Another way that's more common is through a chest X-ray. So bam. So think about the process, right? When you study information, don't just memorize the information, but think about the process of the information. So what would happen? Okay, mother comes to the hospital. She's, get ready to give birth. She gives birth, bam, baby comes out. Baby is not crying, right? Baby is not responsive like the way they're supposed to. So the nurses starts doing their APGAR score. It's low. The baby's kind of bluish, which is not normal. The mother's all concerned what's going on. We're going to take your baby to the ICU right now or the NICU right now, and evaluate what's going on, right? And so the baby's all coughing and not, and it's bluer than normal. Bam, we do a chest X-ray, and it shows that they have this condition. Okay, so whenever you study the information, just try and think, okay, what led to this? That's how you retain information, right? That's how you retain this information. If you look at everything separate, you'll forget it easily. I think that's probably one of the number one things that people tell me. I can't remember this stuff. I'm forgetting it. It comes to me and I forget it quickly. The issue is that you're not looking for the process. You're not looking for the order of things. So try and think about, okay, what led to this? You know, in addition to like look at visuals, write flashcards, all that good stuff. But then also try and think, okay, what led to this? Because that will help, that will make it a lot easier for you to remember it. All right, I hope that little nugget makes a world of a difference with how you study the information. Okay, so the number one way you treat this is to do what? Surgery, point blank period. Okay, there's no, we can't manage this, right? This is not gonna be something that we're gonna do through fluid intake or something. Okay, so we're gonna do surgery. So the surgery, here's the name of the surgery: a thoracotomy with ligation of the fistula. All right, I said that pretty short. Let me say the whole thing: a thoracotomy with ligation of the tracheal esophageal fistula and an end-to-end anastomosis of the esophagus. So they kind of have to do two things, right? So they have to go in and cut, but then they also have to go in and put the esophagus together. So that's pretty much what that is in layman's terms. You know, like, I know the words all sounds all like difficult, but that's pretty much what it is. They just go in, they make an incision they make an incision in the chest and everything, and so they're gonna make this cut, but then they're also going to put the esophagus together. Because remember, there's two disorders, right? It's the esophagus and also the trachea as well at the same time. So, you know, one of the reasons why this is so concerning too is because if they start to eat something, right, instead of it going into the stomach, it's going to go into the trachea, and now they can't breathe. Well, so that's the reason why it's an emergency. We should respond as soon as possible. Okay, so that's the treatment. Let me say the treatment one more time. Thoracotomy with ligation. Yeah, no problem. A thoracotomy, Thora, right? Cotomy. Remember so whenever you hear the word otomy, just think I'm removing something. I'm cutting something out. Otomy, right? That ending suffix. So, and thora means what? Like the chest cavity. So thoracotomy with ligation of the tracheal esophageal fistula and a end-to-end anastomosis of the esophagus. All right, a thoracotomy. Some patients may not be able to tolerate it. So they have to do multiple surgeries. All right, so they may not be able to tolerate it immediately. They may have to do multiple surgeries before the patient is completely cured. So it's called a thoracotomy with ligation of the tracheal esophageal fistula. And so part 2, end-to-end anastomosis of the esophagus. So meaning that after we separate it and everything, then we're going to go and merge the esophagus like the way it's supposed to, like, and put it in, like, that's what pretty much what it means in layman's terms, right? So we don't obviously we're the nurse, we're not going to do the surgery, but you need to at least understand what they're doing. Okay, so that's what esophageal atresia is, with tracheal esophageal fistula. TEF is the acronyms. All right, TEF is the acronym. All right, okay, next one. So far we've done 4. Okay, number 5, phenylketonuria. Phenylketonuria. Let me spell it for you. PHENYLKETOURIA. PHENYLKETOURIA. All right, phenylketonuria. Okay, very common. Also very, very common diagnosis with for the exam, not clinically. I don't think I've had. I haven't seen too many patients that have this problem. Right? It's not super common clinically, but it does happen. No, this is number 5. So far, okay, let me do a quick recap. Number 1 was pyloric stenosis. Number 2 is Hirschsprung's disease. Number 3 is Ray's syndrome. Number 4 is esophageal atresia with tracheoesophageal fistula, which is TEF. And this number 5, phenylketonuria, PKU. Okay, so thank you for sharing the broadcast too. I appreciate your hearts and the likes. Yeah, keep tapping the screen, liking the screen. When you do that, it's really great. What it does, it helps to, I'm not sure exactly, but I think what it does, I think it helps to make the broadcast more visible, so that way other people can watch the video too. So thank you for the likes and the hearts as well. Okay, so phenylketonuria. So this is pretty much an abscess. So there's something called phenylalanine. Phenylalanine. Let me spell it for you. Yeah, thank you, Deborah. PHENYLALANINE. Yeah, Maria, that's right. One more time. PHENYLALANINE. Can somebody spell that in the chat box for me? That's really good. I appreciate that. Thank you for the beautiful hearts and likes. You guys are so wonderful. I appreciate it so much. There you go. That's how you spell it. Okay, so this is pretty much where there's an absence where they don't have this enzyme that's able to metabolize phenylalanine. That's pretty much what it is. So they don't have, it's like, and this is an important, the phenylalanine is an amino acid. Okay, so pretty much with a baby that has fetal ketonuria, they don't have the enzyme that metabolizes this amino acid. All right, so as a result, they can have too much of it in the system, which can lead to mental retardation. Oh, thank you, Christy. I appreciate you for saying that. So that's why this is what the concern is. So typically, we will do with the baby. We're gonna do something called a girthy test. Let me spell it for you. All right. I try to pronounce the words, but it's like when I pronounce it, it doesn't sound as strong. GUTHERIE. All right. Put that in the chat box too. GUTHERIE. So it's a girthy blood test. So this is pretty much a heel stick. Usually they'll do this about close to discharge of the baby. So not when they first come out of the womb. So about near discharge, and they'll do a heel stick blood test, right? And that's pretty much just taking blood from the heel. Okay. Did you know? Actually, I'll go into another tangent. But anyways, though, so they'll do like a heel stick blood test to collect the blood, and that will show whether or not they're positive for this deficiency. All right, whether or not they don't have it. So here's some of the assessment. Okay, here's some of the assessment. They're gonna have, they may have experienced musty urine color. All right, musty urine color, vomiting, irritability. For some patients, because of this reason, there will be a lack of melanin. So the baby may be more likely to be blonde, more likely to have not have melanin, blonde hair. I forgot what other things I put on here as well, but that's usually, it's more common with babies that identify those characteristics. Okay, so that's the way it's usually diagnosed, from doing a heel stick blood test. I remember when I did it. We literally took the blood and then we dipped it into something. We either dipped it or we put it on top of something, and then we looked to see if it changed a certain color or something. That told us whether or not. So that told us whether or not they were positive. Okay, all right. So the treatment. Here's the treatment. Very easy. They need to be on a phenylalanine restricted diet for the rest of their life. I should have gotten the specific things for you here. But pretty much with sometimes with some of them, they will do breastfeeding. But the biggest thing though is that they have to be on a phenylalanine restricted diet, meaning that they can't have food that contains phenylalanine. So this is going to be like dairy products, meat, fish, chicken, eggs, beans, nuts. I feel like that's everything, right? Like I feel like that's all the food available, you know? So yeah, so they pretty much can't have that in their diet, okay? So they have to have they have to be on a phenylalanine restricted diet for these patients. Okay, all right, so I'm gonna do a quick I'm gonna do a recap, and then I'm gonna do a quick NCLEX question really fast. You guys wanna do an NCLEX question? If you wanna do an NCLEX question, put yes really quick in the chat box. We're gonna do a really quick NCLEX question. Oh, I don't know about sweeteners. I'm not sure if sweeteners contain phenylalanine. I have to look up that. I never learned that before. Maybe it does. But yeah, if you're ready to do a question, put it in the chat box really quick. We'll do a quick NCLEX question. Like I have 5 minutes. We'll do it really, really fast. Yes? Let me know in the chat box if you want to do a question together. All right. Oh, and then also what I was going to say too, like I said as well, I am having, if you find this helpful, all right, if you like the way I teach, I am having an 8-hour crash course, NCLEX RN review. We will work on the one for LPNs, I promise you. But for LPNs, we are having a 2-day review class in September. But anyways, though, I am having an 8-hour NCLEX online NCLEX RN review crash course class. That's going to be held Saturday, July 28th. All right, it's going to be held Saturday, July 28th, which is a Saturday from 10 to 6 for 8 hours. We're going to go straight in with content all day and then strategies at the end. Priority questions, standard questions, everything for 8 hours. We may stay on longer because it's a lot to go over in 8 hours, but if you like this information, sign up for that class. What I'll tell you though is that I'm not taking more than 100 spots. Okay, and there's 132 people on right now. Thank you for sharing this broadcast. But yeah, we're not taking more than 100 spots, and we already opened up registration on Friday. Right, so the spots are going already. So if you want to sign up before all the spots are filled, that you just type the word crash in the chat box, or simply go to, and we'll send you the link to your messenger box, or simply go to bit.ly/RN crash class, all one word, all lowercase, bit.ly/RN crash class, Saturday, July 28th, from 10 a.m. to 6 p.m. If you're Pacific time, that's going to be 7 a.m. to 3 for you. If you're Central time, it's going to be 9 a.m. to 5 for you. Okay, so put that in your schedule. All right, so quick recap. The recap was number 1 was pyloric stenosis. Number 2 was Hirschsprung's disease. Number 3 was Rey syndrome. Number 4 was esophageal atresia. And number 5 was phenylketonuria. Those are the 5 disorders that you must know for the NCLEX exam. Now, here's the next thing. I want to do a question with you. All right, here's the question. All right, I'm going to repeat the question twice. When evaluating the growth, all right, so this is a different PEDS question, not related to what I talked about tonight. When evaluating the growth and development of a 6-month-old infant, a nurse expects the infant to be able to perform which of the following actions? A, transfer a toy from one hand to the other, crawl and display fear of strangers. B, sit for a moment without support, turn over completely, and reach to be picked up. C, release a toy by choice, pull self to a standing position, and play peekaboo. D, display pincher grasp, sit alone, and wave. One more time, I know it's a lot. When evaluating growth and development of a 6-month-old child or infant, the nurse expects which of the following for them to be able to do? A, transfer a toy from one hand to the other, crawl and display a fear of strangers. B, sit for a moment with no support, turn over completely and reach to be picked up. C, release a toy by choice, pull self to a standing position, and play peekaboo. D, display pincher grasp, sit alone, and wave. All right, so I saw C, B. All right, so C and B, that's what I'm seeing so far. C and B. Tell me why you think it's, well, actually, this is a pretty straightforward rationale. It's a very straightforward rationale. All right, C and B. Okay, B, B, B. B, right? B. B. Okay. C, okay. B, okay. B or D? Okay, you ready? Here's the answer. Ready for the answer? I don't have my drum roll. If I had a drum, oh my, that would be so good. If like I could just like do like a background drum roll, like da 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 da. That would be so cool, right? Okay, all right. Here's the answer. Ready? The answer is gonna be B as in boy. Okay, B as in boy. So the B is sit for a moment without any support, turn over completely, and then reach to be picked up. All right, remember this is for a 6-month-old child. So here's the thing. These are B is the only one that's correct for somebody that's 6 months old. The other ones is actually more ideal for a child that is 10 months old. All right. So the other ones, like the other choices, are more for 10 months old. B, though, is the only one for 6 months old. Okay. So yeah, that's pretty much it with that one. So this is the thing. So that's the thing about the exam. The exam, what it does, like you just have to be comfortable with understanding the normal development of the baby all the way to the adult, because that's the type of questions that you see on the test. So the B was, thank you, Nicole. B was sit for a moment without support, turn over completely, and reach to be picked up. That's 6-month-old. Okay, yeah, that was your choice, Fami. Okay, good. Your son did it. See, if you're a parent, you have an advantage. Okay, good. All right, so yeah, so that's it, you guys. All right, thank you so much for watching. Thank you for your answers. Thank you for sharing the broadcast. I appreciate you for being on here. Like I mentioned earlier, if you want to sign up for the free mini course, you can. Just type the word mini in the chat box, and we'll send you the link. It's a free you receive like 5 video teachings over the course of 5 days via email to help you, to teach you content. You can sign up for my crash course, RN crash course class on Saturday, July 28th. Only 100 spots available. We've already started filling spots over the weekend. So we're not taking more than that as far as the number of people that can join. So if you want to join that, type the word crash, or you can go to bit.ly/RN crash class. All one word, all lowercase. I'll be back on tomorrow. Oh, sorry, not tomorrow. I'll be back on next week. Same time, 6 p.m. time. I haven't decided what I'm going to talk about next week. It's usually a surprise, to be honest, because sometimes I try to go off of what people are telling me they need the most. So that's why it's not always you're not always going to know ahead of time. Sometimes you will, sometimes you won't. All right. So thank you for watching. Join my free NCLEX Prep for Success Facebook group too. If you're not part of our group, join it right now. I would love to see you in our group too. In there, we put weekly NCLEX questions. Tomorrow, we're gonna put a new question tomorrow in the group tomorrow. So we put the rationale in the group only. So it's on the page, but on the group, those where you get the rationale to the questions. All right, thank you for watching. I hope you have a wonderful rest of the day. You're welcome. There was somebody that asked a question earlier who said, what if it's been 10 years since you graduated nursing school and you're not sure what route to take as far as the help that you need? If it's been 10 years, honestly the best thing for you is my 8-week mastermind review class. That's the best thing for you if it's been that long since you graduated from nursing school, because then you need more longer help. But however, though, the mastermind class though doesn't start until, the next one's not until October. So you can either wait till October for that person that asked that question, or you can attend the 3-day review in August, because you need longer help. You know, if it's been 10 years, you're gonna need longer help. Or you can look into, I do have one-to-one mentoring, but the spots are full for the next month or so. So, but you can still join the wait list. To join the wait list, you have to inbox us. We'll send you the link to join the wait list. I don't have the link. I would just tell you right now, but I don't have the link off the top of my head. That's the reason why, to be honest. I'm not trying to be secretive with it. Okay, I just don't remember what the link is. It's a long link. That's why I don't remember it. But if you want to join the one-to-one mentoring wait list, you can, but you have to inbox us because I don't have the link off the top of my head. All right, you guys, have a wonderful rest of the day or night. See you next Tuesday. If you have any questions about anything else, inbox us right here on the Facebook page, or you can go to the Facebook group is NCLEX Prep for Success group. NCLEX Prep for Success group. That's what the Facebook page. You know what? Next week I'll do management of care. Yeah, next week we'll talk about management of care. That's what I'll do next week. Yeah, we'll do that. We'll try that next week. I'll pick a random topic about management of care, since you said that, Maria. Okay, you guys, have a wonderful night. All right, I'm going to another teaching.